Today we are working on the evaluation of the head, neck, and thyroid. We always begin with introductions. Hi, Steve.
Hi.
I'm Angela, the PA who will be doing your exam today. We also begin our exams with hand washing. And consistent with our usual protocol, we begin all of our exams with inspection. Inspection of the head involves general alignment. Any deviation from the usual vertical alignment can be associated with conditions such as torticollis. Inspection of the scalp involves distribution of hair, any patterns of loss. We also will part the hair to look for any lesions, rashes, or any evidence of infestations. Inspection of the face involves general symmetry, any unusual features such as scars, masses, lesions, any unusual movements, muscle movements such as tics, tremors, or fasciculations. Also any evidence of characteristic facies, and by that we're referring to the constellation of features that tend to be associated with particular conditions. And these can be genetic, for example, Down syndrome, or they can be acquired, such as acromegaly, and Steve has no facies. We also will palpate the head for general size, shape, masses, and any tenderness. We palpate the scalp for mobility and for the texture of hair and distribution. We also can consider a couple of special exams that involve the temporal artery. The temporal arteries are located just anterior to the ear and are generally fairly easy to palpate the pulse. The anterior branch of the temporal artery passes toward the eye. Palpation along this distribution, you would note any tenderness, induration, or hardness, which can be associated with conditions like temporal arteritis or giant cell arteritis. Another special test that can be done over the temporal artery is auscultation for bruits. This is done with the bell of the diaphragm, with light pressure over the temporal artery, again listening for bruits. Again, this is a special test that is not part of the routine exam. Then moving to the neck, we again begin with inspection of the neck for general position, alignment, the alignment of the trachea, any rashes, lesions, any masses, any fullness over the thyroid, any extra skin folds or webbing over the lateral part of the neck that can be associated with conditions such as Turner syndrome. To get a better area for inspection of the neck, it's also helpful to loosen the gown. And Steve, I may need to have you just hold the gown at a comfortable height for you here, but this gives us a full view of the neck area. We can continue with palpation of the neck over the trachea. This should be midline, it should be vertical, it should not be tender or pulling or tugging. We can also evaluate the range of motion of the neck by having you tuck your chin down to the chest and look up way up to the ceiling. This is to evaluate flexion and extension, and then look to your left, look to your right, and this is to evaluate left and right lateral rotation. And then finally we'll have you tip your ear to the shoulder and the other way, and this is to evaluate left and right lateral bending. Finally, we'll check the strength of the neck by having Steve shrug your shoulders and don't let me push down. Great. And then finally, I'll have you Gently turn your head to the side and push against my hand, and then turn the other way and push against my hand. Great. So this evaluates the strength of the neck muscles as well as a confirmation of the function of cranial nerve 11, the spinal accessory nerve. Then we will move on to evaluation of the lymph nodes of the head and neck. The lymph nodes are evaluated with the pads of the first 2 to 3 fingers so that you can apply gentle pressure, usually in a circular motion, over the distribution of the lymph nodes. So we'll begin, and we're always evaluating the lymph nodes for size, shape, any tenderness or warmth, the consistency and mobility. Lymph nodes that are fixed or matted can be signs of some underlying pathology. To begin with the anterior auricular nodes in front of the ear, these are sometimes palpable in conditions such as conjunctivitis or other ocular disorders. Moving behind the ear and over the mastoid are the posterior auricular. And then, Steve, I'm going to have you turn slightly towards me so that the camera can see as we go posteriorly to the base of the occiput for the occipital nodes. And these also follow down the neck posteriorly. Then as we come anteriorly onto the neck, we'll look for the posterior cervical nodes, which will be found in the posterior triangle. This is defined by the posterior border of the sternocleidomastoid, the anterior border of the trapezius, and the clavicle. So palpating within this region for the posterior cervical nodes. And I'll have you swing back towards the camera. And we'll do the same thing on your right side for the posterior cervical. Then we move anteriorly for the anterior cervical lymph nodes, which are found in the anterior triangle. So this is defined by the anterior border of the sternocleidomastoid, the midline of the trachea, and the angle of the mandible. So palpating within the anterior triangle for the anterior cervical lymph nodes. And it's generally fine to palpate these symmetrically at the same time. As we move up to the angle of the mandible, we will evaluate for the subtonsillar nodes, and then following the angle of the mandible for the submandibular nodes, and finally just within the angle of the chin for the submental nodes. Finally, we will evaluate the supraclavicular nodes. And these can be a little trickier to find because they're deep within the supraclavicular fossa. So one maneuver that can help in this evaluation is, Steve, I'll have you put your hands on your hips and then just roll your shoulders forward. That's perfect. So you can see how this nicely accentuates the depression within the supraclavicular fossa, so allowing you much more easy palpation to see if there are any enlarged nodes present. This is a particularly important area to assess. You can relax. If you do ever notice a lymph node within the medial angle of the left supraclavicular fossa, this can be a somewhat ominous finding and is actually referred to as Virchow's node. It is sometimes associated with occult malignancies within the abdomen or thorax, so this would always be a finding that warrants further evaluation. So finally, we will evaluate the thyroid gland. This is best done from behind the patient and then reaching your hands around the anterior aspect of the neck. So it's always helpful to let the patient know what you're doing so that they're not surprised or alarmed by your maneuver. So Steve, I'd like to evaluate your thyroid next, and I'll stand behind you and be reaching around with my hands to the front of your neck.
Okay.
If that's okay. It's also helpful to provide the patient with a little cup of water so that they're able to sip and swallow at various points during the evaluation. So from this position, you can see that your hands are now nicely aligned with the anatomic structures of the neck to help you find the thyroid. So you'll use primarily the first two fingers of each hand, and you'll locate in the midline first the thyroid cartilage, which is more broad and flat. Then you'll slip your fingers down to the thyroid cricoid cartilage, which is the next prominence below the thyroid cartilage. And then as you travel down slightly, you will be over the trachea. The isthmus of the thyroid gland will be over the trachea. And with swallowing, the thyroid gland will briefly glide up over the trachea. So that, Steve, I'll have you take a sip of water and hold it in your mouth. And then as Steve swallows, go ahead and swallow, the thyroid gland can ride up and you'll feel it underneath your fingers over the trachea. If the trachea is completely retrosternal, you may not feel anything at all, and that would be perfectly normal. After evaluating the isthmus of the thyroid, we'll evaluate the lateral lobes. We'll evaluate these one at a time. And to start with the right lobe, we will move our fingers laterally until you encounter the little groove between the sternocleidomastoid muscle and the trachea. And it also helps to have Steve move your head slightly to the right, so that provides a little more flexibility within this little groove. Now with the fingers of your left hand, you will very gently apply pressure to the right, so that now as Steve takes a sip of water, and you can swallow, the thyroid lobe on the right is more easily palpable under the fingers of the right hand. To do the left lobe, we'll do the same process the other direction. So Steve has already moved his head to the left, providing a little more flexibility for palpation within the groove on the left. With the right fingers, we'll apply very gentle pressure to the trachea to the left, and then Steve can go ahead and take a sip of water and swallow, and the thyroid will slide up very briefly. So now we have evaluated the isthmus of the thyroid over the trachea and the left and right lateral lobes on each side. At the conclusion of every exam, we always wash our hands. And that concludes our exam of the head, neck, and thyroid.